I'd like to tell you about a patient who was very lucky to have lost her insurance. I wasn't seeing her in my office or as a patient. She's an acquaintance and we were chatting, and she was lamenting that her insurance had been canceled just a few weeks ago, and now, wouldn't you know it, she developed a problem with her eye. So I asked her a few questions about it, and then I retrieved my ophthalmoscope from my truck and took a look. Then I called up a group of retinal surgeons who don't even know me and told the receptionist the history and my findings. She asked 2 questions. Are you an ophthalmologist? And I said, no, I'm an internist. What's her insurance? And I said, she doesn't have any. It was canceled. Oh, so she's self-pay. Let me have you talk to the technician. In a few minutes, the technician came on the line and I told her the story again. I admitted that I had never actually seen a retinal detachment myself, only pictures, but I thought that's what the patient had. She said, well, why don't you send her over? There's a doctor here who can see her in about an hour, and oh, by the way, ask her not to eat or drink anything, just in case she needs to have surgery. The patient went on her way, and a few hours later called me back and said, they found a retinal tear, and what you were seeing was blood. They were able to do a little office procedure that they said would probably fix it and prevent a detachment. A few weeks later, she's doing fine. I asked her how much it costs, and she said $900. But what's an eye worth? She asked me. She got her procedure. The surgeon will get paid. She's a responsible, working woman who understands that it's important to pay people for their work. But what would have happened if Access, the ironic name of the Arizona Medicaid program, hadn't cut her off for making $100 a month too much? I think the receptionist would have asked, well, she needs a referral. You need to fax us a referral. I couldn't have given her a referral. She would have to get a referral from her primary care provider in her health plan. Now, I have seen what's happened in at least 3 other cases of insured, covered patients who went to see their primary care provider, their gatekeeper, the barrier to specialist care, who missed the importance of the diagnosis, and who ended up with expensive, difficult, complex surgery, more than one operation, and got a really rather poor result. Now, if this bill goes through, this woman will probably end up on Medicaid. Or, if not, then on some other insurance plan that she'll be forced to buy, even if she can't afford it. And it's likely she couldn't afford it, even with the subsidies that are supposed to be given. And a lot of these insurance plans are just like Access. They're managed care plans. Here is an article in the Wall Street Journal of November 27th that the insurer plans to alter the fee-for-service model. And what it says is, Blue Cross is trying to change the payment model to a system in which doctors and hospitals earn more by keeping patients out of doctors' offices and hospitals. It's real easy to keep a patient out of a doctor's office. Just don't give him an appointment. And we're also going to be adding on primary care doctors. This patient didn't need a primary care doctor. She knew she had a serious problem. She knew she needed an eye doctor. I had a little advantage in that I knew who to call and what to say to get her in, and perhaps with my MD degree I had a little more credibility than she would have had. I know what happens to patients who are on Access. They can't get in to see the specialty physician. A patient who has seizures and needs to see a neurologist to adjust the seizure medications can't get an appointment because even the ER doctor can't give her the proper referral. Even the hospitalist who's discharging the patient from the hospital can't write the proper referral. It has to come from the person who is accredited by the Access plan to make that referral. And many times they're reluctant to do the referral, or else their offices are just jammed, they can't work in enough patients, or the specialist only has so many openings for Medicaid patients. If the surgeon had seen my patient who was on Medicaid without a referral, he couldn't have gotten paid. He couldn't bill Medicaid, he couldn't bill the patient, and he was violating some kind of rule even by seeing her without a referral. Private medicine gives patients the treatment that they need. and enables doctors to stay in practice. That's why we need to defeat this so-called healthcare reform bill.